in our office are like, well, you remember SARS, right? What happened with SARS? Or what about MERS? Or what about, Zika? Or what about, because you've been here for all those things. So this is a little bit different, I gotta say, even in my career. I was like, yeah, okay, this one's got my attention maybe a little bit more than some of the other ones. As I was saying, I kind of emailed the teacher quick, like, hey, I'm available because we were kind of down internet and phones, so there wasn't, it's amazing what we did before we had internet and phones to do any work. So I said, hey, this might be a good time if I could sneak over and talk. So unfortunately, I wasn't able to pull any of my slides and stuff down, but I see you have a really good resource up there. There is a map that's real time that's being done by Johns Hopkins University that is showing real time data. So I thought some of it I can give you some of the basics and then answer questions that you may have related to coronavirus or COVID-19 as it's being called. So we know this was first identified in Wuhan, China. Right at the end of December, it really kind of started blowing up with cases there. I don't know how many are there. I can't keep track of the numbers, but tens of thousands of cases over there. Again, the numbers here in the U.S. are starting to tick up. As we test more, those numbers are going to go up, which would be expected. Anytime you start looking for any disease, whether it's like our hepatitis C cases are really high because we test all baby boomers for hepatitis C. So when you're looking for it, you're going to find it. And that's what we're going to see with this virus as well. There's so much in the media right now, so I think sometimes we have to listen to it and then take a breath, right? And then really figure out what it all means and why we're doing some of the behaviors that we're doing. So initially, the first thing with any type of illness outbreak is identifying cases. That's kind of where we are. And locally here, I just want to let you know, we have no cases in Oswego County. We have one person that we have under precautionary quarantine. It was a student that was in an overseas program. That student is healthy, but there's a requirement if you come from one of 5 countries now. See if I can remember them off the top of my head. Italy, China, Japan, Iran, South Korea. If you've traveled to any of those countries, when you return to the U.S., you're going to be required to be in what we're calling precautionary quarantine. If you're not sick, for 14 days. If you are sick or have symptoms, you'll be under a mandatory quarantine or isolation, which is essentially the same thing, other than we can make you stay there more so than we can if it's voluntary. Again, for 14 days, unless you need to be hospitalized if someone gets sick enough, then we'll make arrangements that way. But so those are real things that are happening, kind of unusual in some ways, not so unusual in other ways. If I had somebody come in that tested positive for whooping cough, we're going to tell your parents, you need to keep the child home for 5 days until they have 5 days of antibiotic. Don't let them go out of the house because they're going to spread that disease if they do. And most parents say, okay, we'll do that. So that's what we're seeing right now with most of these folks that we're asking to kind of stick close to home for 14 days and monitor their symptoms. So again, it sounds really unusual, but in the public health world, we kind of do some things like that on a regular basis around other diseases too. Okay. Questions? Stop me if you have questions. There's something you're really like, why are we? So that's part of it right now. So the key right now is to identify somebody that's sick early and isolate them so that we can stop that disease from spreading. With this virus, it spreads a little easier than flu, right? So what we want to do is stop other people. So if I'm sick with this virus, it's most likely that I'm going to probably cause 2 other people to get sick if I'm not identified and isolated. So then once so now I'm sick and I get these 2 sick, now these 2 are going to get 2 more people sick, and then those 4 people are going to get, so you can see why these numbers seem to grow pretty quickly, right? So by kind of keeping people close to home, keeping them away from other people, we want to stop that explosion. Why does that become important? Because if we don't, if you think of a little, you guys like to think of grading curves, right? But if you think of an illness curve, So if we have number of cases and we have time, if we just let everybody run around spreading this, you're going to see a curve that kind of goes like this, okay? So you're going to see a big spike really quickly in people that are sick. The problem is this line here might be where our healthcare capacity is at, right? So if we have this many sick people, but our healthcare is only able to handle this many sick people, we have a problem, right? So what we try to do is flatten that curve out, so if we can keep people away from each other, keep people out of large groups, keep people that are sick close to home so they don't infect a lot of other people, we can make that curve where people get sick look more like that. So our healthcare, we can get people the treatment they need, we have the medical resources, we don't see lack of mask and hand sanitizer and things kind of like we're seeing now, because people are a little panicked, a little anxious. So that's why some of these strategies are put in place that you might be hearing about in different communities, states. Yeah.
Do you think the media is blowing it out of proportion?
Well, the media is always looking to sell papers and make headlines. So I think, there's truth in most of what they're saying, but there's always that element of how do we get people to pay attention to what our network is saying over another network. I think this does spread easier than flu. Death rates right now are much higher than flu. I think as we test more people, we'll see that death rate come down, because right now we're only identifying the sickest of sick people. So those people that are kind of sick and getting well, we may not even know that. Once we test people and we have a bigger pool to see how many people died from, that death rate will go down. But right now it's in the 2% range. Flu is about 0.1%. So again, but we identify people with flu much easier than we are with this right now.
I don't know if this is true, but some people feel like hand sanitizer does more harm than good by killing the good germs too.
Well, there's been lots of stories out there around hand sanitizer and how we've overused antibacterial products. I think in this case, it's probably still a good idea to use it for this.
Washing your hands.
Because, soap and water is always appropriate to use. So in soap, I don't think there's been a run on soap yet, but soap and water when it's available is always beneficial. And again, that's the mechanical process of getting those germs. So you have to wash for that 20 seconds and scrub, and that's going to work for pretty much any germs, viruses, bacteria. Where the hand sanitizers again are a good substitute if your hands aren't dirty. If your hands are already visibly dirty, you have to wash them first anyway. So you're kind of doing the job there. But soap and water will work for this. And that's actually the messaging we're pushing out first. Use soap and water when available. The antibacterial or alcohol-based hand sanitizers, if soap and water is not available. The other thing we have to change our messaging, how do you cover your coughs and sneezes? Yeah, for how many years I've been going to teach preschoolers, please cover your cough. Really the recommendation right now is to use a tissue. If it's available to cover your coughs and sneezes, throw it out immediately, wash your hands instead of using your sleeve. Okay, so again, a little bit of change in guidance from the Center for Disease Control. So all these little ones will tell you to use yours, which is still good if you don't have a tissue to do that, or inside your shirt, but you still want to cover your coughs and sneezes. And a lot of the messages about preventing coronavirus is the same that we would give for preventing flu or other respiratory types of illnesses, right? So cover your mouth, wash your hands, stay home if you're sick, stay away from people that are sick. Those types of messages. Clean, high-touch surfaces in public areas, tabletops, doorknobs, your cell phones, gaming controls, remotes, those types of things where lots of different hands frequently touch them. Those are areas that we should be cleaning quickly and frequently. Other questions? Yep.
What does a mandatory quarantine look like? So how would that work if somebody in your family or whatever got sick?
So ideally, what would happen is with a mandatory quarantine, again, we're always under the guidance to try to make it the least restrictive as possible, because this is America and everybody has civil liberties. So we're really careful about those things. So ideally, if we can quarantine somebody at home, If they're really sick and they have to be in the hospital, they'll be quarantined in the hospital and in isolation there. Ideally, if we have a negative pressure room where the air in that room is not being recirculated out to other parts of the building, is where we would keep people that are really, really sick. For those, again, 80% of people that get this illness have mild illness, so most people are going to be able to be managed at home. So ideally, we'd want them to be home. We'd want them to have their own sleeping quarters, and we want them to have their own bathroom, ideally. And they'd be kind of like the ultimate grounding, right? You'll get sent to your room for about 2 weeks, about 14 days, ideally, to keep them separate that way. We wouldn't want you sharing living space. We wouldn't want you sitting down at a table eating a meal together. So it's kind of like, bring your food up, knock on the door, and here it's there, and let somebody come out and get. We want to minimize those contacts, keep that 6 feet ideal distance. So that's what we would look for. We would go out ahead of time and look at homes to make sure those kinds of needs could be met. If there's not a separate bathroom, we would make sure there's cleaning supplies. So if I was the person that was sick, ideally I would clean down the facilities that I was using when I was done, so before the next person went in. The other thing we could look at is different quarantine kind of sites or centers. SUNY has several set up for students returning back that can't self-isolate at home, that there's one of 3 different facilities they could choose to go to. We're looking at other facilities locally here, so if somebody didn't have an ideal situation at home, that we could put them in a place, either keep the sick person at home with the comforts and ask the well members of the family to go stay somewhere else. But it is the county's responsibility to make sure that those are enforced, that, if I live with my 92-year-old mother, I have my own room, I have my own bathroom, but I get the groceries, I go out to pay the bills, I do all that, and my 93-year-old mother couldn't do that, then the county would help step in and put services in. So we may send people to the grocery store for you to deliver food. We may set you up with home delivered meals to have people bring you food, and try to take care of that day-to-day business that you might need, getting medications, getting pets cared for if that needs to be done, whatever it might be.
So what if, I would hope people wouldn't do this, but if somebody is supposed to be on quarantine, is somebody checking to make sure that they're staying?
So for people that are on mandatory quarantine, we have to lay eyes on them daily. So we have to send somebody to the house to see them, and we have to randomly check in with them some other time during the day. Phone call, FaceTime, texting, somehow kind of get a status on them. We're checking temperatures twice a day. Same with those that are on precautionary. We have to check in with them daily. We don't have to go make a home visit, but kind of, hey, how you doing? Did you take your temperature? What's your temperature look like today? And monitor them for symptoms, so that if they start developing symptoms, we can get them out of that situation and get health care for them, and see what's going on as soon as we can. So
that has to require in areas like, I know our county isn't experiencing it, but what is it, Westchester?
Oh,
They have to have way
Westchester
more
just called in the
personnel.
National Guard. They have a way bigger health department than us to start with.
Yeah.
But some of the planning we're doing locally is we've met with all the divisions of our health department. So we have personnel that typically would go out and inspect restaurants. They're on our list to go out and check homes. Go check for a separate bathroom, separate bedroom, cleaning supplies, and let us know that it's safe to to send somebody home there. So we're, training and utilizing other staff that may not have typically been used in that capacity. And then we would go from there if we got to the point where, for Westchester.
Yeah, I didn't realize they had a national.
Yeah.
That's pretty
Yeah,
intense.
they did, and they've now set up about a 1 mile quarantine area, where they're restricting movements inside a 1 mile radius. So, you can't go outside that radius if you live there. Again, think of that flattening the curve, and that's what all these strategies are looking to do, is try not to let this spread so we get real spikes in the number of people all at once that are ill.
What if someone snuck away?
What if somebody snuck away? We have ways of making them comply. Turn into bail reform, right? The jails are really, no. You know, again, for the most part, in our experience, most people are genuine, kind-hearted people, and they don't want to make other people sick. And again, we're assuring them that any needs that they have, please talk to us before, you know, you're gonna sneak out and do something, because chances are we can help you get that done and not put you or somebody else at risk. So, but yeah, it can be a legal document that's put in place, and there can be ramifications if people decide not to listen to that. Fortunately, it usually doesn't come like that.
I have a question.
Yeah.
So because it is a virus, what is the treatment?
Right now, again, flattening that curve gives us time. There is no treatment other than supportive care. So again, if people are having difficulty breathing, they may end up on respirators. They may be getting other kinds of breathing treatments to try to open airways. But for the most part, it's just supporting those symptoms, reducing fever, managing cough, managing airways. And again, and some of that flattening the curve gives us a time for vaccine development, antiviral treatments that we hope, you know, we can get developed. If you remember H1N1, probably all of you were vaccinated at some point for it, a few years back. But I think the first calls we were getting on that were about April, and I want to say we were out vaccinating in schools probably that following school year, October, November. So it does take a little time to develop those medications and treatments, but again, some of it trying to contain it, slow the spread down, buys us time to get those products developed.
So say, I mean, I know that a lot of the people that pass away are older people. What's the lifespan once you get it as an older person? I know that's kind of a morbid thing to ask, but like if you get it, contract it,
Like how quick are people dying
Yeah.
from it? I haven't seen, I don't know, but yeah, we know it's mostly seniors or those with other like comorbid conditions, other underlying health conditions that are most vulnerable. Like we're really concerned with nursing homes, you know, you get it introduced into a nursing home, it could just really.
but that's the same thing with the flu though. There's no cure for the flu.
Absolutely, but we have vaccine for the flu, we have antivirals for the flu, so we can manage flu, and we can make, you know, most nursing homes are gonna make sure all their patients have flu vaccine, that even if they do get the flu, it tends to make it less severe. The other thing we have is we have antivirals against flu, so once there's a flu case, typically on a floor of a nursing home, they're treating everybody on that floor with antivirals to protect them. So we do have some better flu management resources than we do for this right now. And again, which makes, because this is a new virus, so nobody's been exposed to it before, so we have everybody that's kind of potentially susceptible to this. Where with flu, we can try to knock the number of people that are susceptible because we can vaccinate them or because we can use antivirals after that. So I know you guys are like a bioethics class here, right? So what do you think of some of the impacts as far as, what do you think? Is it fair for us to be able to say, hey, you gotta stay home if you have this for 14 days?
Well, actually, one of my questions was, I don't know if you can answer it, why are people, like that lawyer, for example, why does anyone even know that he has this? Isn't it confidentiality? Like, I don't understand why people know
Yeah, and I
he's doing
don't
this.
think they flat out released his name in public, so there are certain things that we definitely
Because I wouldn't want people to
have
know.
to protect.
With him in the hospital.
Yeah,
Yeah.
Right.
and we do everything we can locally to protect that information. But yeah, things like that tend to circulate. You guys know in this community when somebody does something, everybody knows,
Yeah.
whether it's an illness, whether it's, you know, a ticket, whether it's whatever. So yeah, so I don't think you've seen anywhere where that family's name was released in the paper, but typical strategies is what we'll do is when we have somebody sick, we do what's called contact tracing. So they would start with me, like if I got sick, they would say, okay, who do you live with, right? So they're looking at my husband, my son, and my daughter. Okay, who do you work with? They're looking at all those potential people. Oh, you went to a concert at the college this weekend? Terrific. who all went to that concert at the college? Oh, you went to a show in Baldwinsville? Great. What time did you go? What show was it? And okay, so then you may start hearing messages go out, hey, if you were in this location at this time, and we do that for a variety of illnesses and diseases. So we start with that person and we kind of build out. And so again, once it's like, once the cat's out of the bag and you start expanding and go, hey, yeah, you were at this show, and you're like, oh God, I was at that show. Well, who else? Who was sick at that show? Who gave me something, right? So those questions start to get answered. It's our responsibility not to release names, information. We get down to even trying not to list ages. We may say a child, we may say an adult. Again, especially when you have one case, it's kind of easy to narrow it down if you work hard enough. So again, we had a news release out recently saying, hey, we're monitoring a student that returned from overseas, and our PR person is like, do we want to say where we're monitoring? We're like, no, we're not telling what town or what city that person is, but we're monitoring them and they're healthy, right? So, yeah.
So if you look at that map up there, I mean, China's just blown up.
Yeah.
You think Russia's not reporting correctly?
Could be.
Like South Africa, North Africa?
Yeah. Again, it's all in check.
Yeah.
Mexico.
It's a good question.
And some of it is who's testing, so who's really actively looking for it, and some of it is who's reporting. Yeah. And again, we have the benefit at our health department. Our public health director is named Jiancheng Wang. He is from China. He's a U.S. citizen now. He's brilliant. I love working with him. But he has apps that he can still talk to people in China. So he's been able from the get-go to talk to some of his colleagues in China, and we're really like, what's really going on? Tell us the truth. And so some of his colleagues could say, yeah, it's kind of getting scary. Yeah, things are happening. Yeah, but in China, again, too, you have a communist country. And how he explained it to us was that in some of those townships, there was probably under-reporting because they don't want it to look, when you go up to the central government, like you're doing a bad job. And all these people are sick, so don't say so many people are sick. Right? So they've kind of got a handle on that now. And they're doing reporting, and because they've really cracked down really hard on movement and travel, we started to see a decline in cases in China. So again, in different countries are a little bit faster to be able to implement some strategies based on their government, based on civil rights in those countries. Or lack of, yeah. Yeah. So again, sometimes we have to keep some of those things in the back of our mind with decision making.
How did this disease start?
So it's a novel coronavirus. So coronaviruses, there's lots of different ones, and everybody be like, oh, it just causes the cold. Yeah, several coronaviruses cause the cold, or cold-like symptoms. So this is flu, and flu viruses change a lot. This is another type of virus that just tends to change and mutate. So I think they're still doing some of the finding the backstory on how this happened. But
Do you think it's ever going to become airborne?
it is airborne.
Oh,
Yeah.
okay.
Yeah, it is.
Well, because I saw
So-
something where people said that it wasn't, and they're like, well, it may at some point, mutate in.
Yeah, so right now we're using droplet and airborne protection, so that's why you see in healthcare settings they're wearing N95 masks, they're wearing face shields, they're wearing gowns, they're, again, to protect.
Okay.
Because it is spread through coughing and
Yeah.
sneezing and those types of ways.
Okay.
So,
Yeah.
so in healthcare, they're using a lot of airborne, so there's some debate between airborne and droplet. So droplet's kind of similar, so if I had like the flu that's droplet
Yeah.
and I'm coughing and sneezing, it's gonna, fall out on this table, and then
Yeah.
you're gonna be here, and the next student here is doing this, and
Yeah.
you know how.
And that's what I assumed it was at first.
Yeah,
but
it
I
is.
didn't know that it was like.
So it is
Oh.
respiratory, so it's transmitted like
Yeah.
lots of respiratory colds, flus, those types of things.
So I'm sorry, I kind of interrupted your question.
No, it's okay.
To them, she wanted to know, what do you guys think? Do you think that it is ethical to be put on quarantine.
Yeah.
Yeah. I think necessary.
It's for the good of everyone else.
Safety for others, right? Or just like, me not going to school for
Yeah, right.
14 days, sign me up, right? So there, you know, and I know you're hearing about colleges going online and things. So again, some of that, I think, schools are nervous with spring break, the college spring breaks. So you send everybody out all over the place, all over different countries, cruises, parts of the world, and then you want to bring them back. So I think that's some of why some of the universities are looking at, let's give us 2 weeks to see what our students' health looks like, and what's going on, before we put them all back together. So you may see where some are going to the end of the semester, you may see some that are only going a few weeks to kind of be able to assess what's going to happen or the health of their students. Buy them a little time after sending everybody out.
Yeah,
I said they ought to just cancel and leave them here. We don't have it here right now, right?
Yeah.
Yep, voted down on that one.
How about travel plans? I mean, do you think people should be canceling, be worried? I know those, obviously, big areas. People shouldn't
Again,
go.
you should know where you're traveling to. If you're leaving the country, I would definitely look at those travel warnings. I would also look at hotspots. I don't know that I'd be taking a vacation to Seattle right now, or Westchester County, New York right now, if I could avoid that. I think you have to look at health status. I know my senior parents are getting ready to fly to Texas in a couple weeks, and I haven't quite picked up the phone yet to say, not thinking it's a good idea. My dad's on dialysis. Not thinking this is the best idea, you know. Brody will have a second birthday next year. Maybe you can make it too, you know. So I think you need to look at what's your health status. Seniors probably need to look at it a little closer than maybe most of us would probably do okay if we had this.
Is
But
that all on the CDC website?
it is,
those
it's on the
hotspots?
CDC website. The other really important thing is that this guidance change, like literally, like that binder's about 2 weeks worth of stuff. So the guidance changes really quickly. CDC has a great website, our Oswego County Health Department website. I have a staff person that's basically her job right now, is keeping that updated with CDC information, state health information. So that's a really good resource. The state health department has a COVID-19 hotline number. I don't know the whole thing off the top of my head, but it starts with 888. And it's nice in that when you, at least this week, I can't promise next week, this week, if you call it, you will get a person on the other line, and they can kind of triage your call. It's for professionals, it's for the public. So if you have a question, hey, should I go on my vacation? They're going to give you the best guidance, and they may ask you where you're going. They may ask about health status. So those are things to keep in consideration. We're going to try to start a little automated phone system for the county as well. We're hoping to get that up and running maybe by tomorrow, so then we'll push those numbers out. But our health department, health.oswegocounty.com, has tons of information on what's going and kind of latest and greatest kind of stuff. Yeah.
I heard you can get it through Snapchat and TikTok, right?
Absolutely. TikTok. Secret plot. Yeah. Especially if you're using your friend's
Transmitted through
Yeah.
right the phone.
Yeah. So, you should always disinfect it. They'd all be gone by now if that were true.
Sure,
Yeah.
every year's infected.
So, yeah. What else? Other questions?
Oh, yeah.
Really, I would just caution you to look at your sources of information, where you're getting your information. If they're coming up on your news feeds, on Instagram, on Twitter, on Facebook, just really look at the credibility of the source. You can fact check a lot of that information by going to New York State Department of Health, cdc.gov, World Health Organization. Anything you read there, I would fact check if it's not from those organizations, because there is a lot of misinformation and, again, some amped up kind of information that's in there. Yeah.
Okay, so you said there's like more than one type of coronavirus. So when people say they know somebody with the coronavirus or something, do they sound completely stupid because they're not being specific?
Well, it's like, in the theory of the day today, you have to look at context. Are you talking about this new one? Are you talking about, this is a true story. We had to go to the laboratories because labs test for 4 different strains of coronavirus when they're testing for other respiratory. The 4 they're testing for is not this one that's circulating now. So we were getting people with lab reports going, oh my God, my patient tested positive for coronavirus. It's like, yeah, that's kind of like the cold, sniffly kind of one, not the one. So this new one is actually called SARS-CoV-2. So that would be the official virus name, where COVID is the disease. So you wouldn't, it would be on a lab report. So somebody, probably all of us here, has had some type of coronavirus over the course of our lives because it caused kind of cold-like
Yeah.
symptoms, but it's not this new strain that's causing more severe illness.
Is that like the only like thing that like makes it different? That's just a more severe illness. Like why? Like
So,
I didn't.
so there's like I'm trying to think of how to describe it. There's like a family of different types of coronaviruses, and some just cause different levels of illness. This one is mutated or changed to the point where it's able to cause kind of severe respiratory illness in people, where some of these other ones just kind of cause like cold-like symptoms, runny nose, maybe a little cough, but not as severe as what we're seeing with this one. I don't know if that makes sense or not, but just a different strain.
Yeah, I guess it just meant like the hype of like how.
Yeah, the hype is that most people probably never even knew there were coronaviruses before this, unless like you're a science nerd like me, right? But so it's kind of the newest thing. It's kind of, think of like when H1N1 flu came out. It was a new strain of flu. So there's always changes in viruses over time that sometimes they change where they cause different levels or types of illness in people. Or it may be something that didn't cause illness at all in people, maybe another animal that now can cause illness in people. So they're crafty organisms to survive. It's part of their survival. What else?
So I've heard different numbers when it comes to this. How long do they know or think it can survive outside of a host?
Like on a tabletop, something like that. Yeah, I've seen different things from hours to a day or so. I think that again, it's changing. They're still learning a lot of the science on it. I think if we're doing at least daily disinfection of tabletops, doorknobs, it's good. Most of the schools have been instructed to kind of amp up what they're doing at the end of the day when everybody's out of the building. I know countywide for our workforce protection, we've instituted new policies and products to use in our buildings. So yeah, I think with that right now we're not sure, but you've got to assume that it's going to be there for a day or so and do those daily cleanings. And again, when you have a building like this where you have so many people, keep your hands away from your face. It's really hard to do, and now that I say it and you're thinking about it, it's even harder. I had to do a press conference last week, and I was like, oh, now my okay, you know, like your face itches as soon as you want to make sure you don't get caught on camera touching your face.
Yeah.
What else? Does everybody feel like they can take a little bit of a breath now, hopefully? No? Worse? Better?
So
I think it's inevitable we're going to see it. I think it's inevitable we're going to see it.
So guys, we have like 2 minutes left, so if you do have a question, now's the time to ask. Does anybody have any other questions? I do, but it's kind of, I mean, I just told them before I came in. Yesterday, my daughter had probably one of the worst asthma constant attacks all day, pretty much, that she's ever had. So she's been on steroids all day, and then now she's on an oral steroid.
Mhm.
Not just because of coronavirus, but I'm considering not sending her back to school for the whole rest of the week, being on a steroid like
Yeah.
that. I mean, do you think that's over the top, or, I mean,
think-
with the, not because of coronavirus, but
Yeah.
the flu is
I
going
think,
around.
yeah, we are still being hammered with flu. Flu is still widespread. We're probably still getting a couple hundred flu reports every week at the health department. And they're only the confirmed ones, so a lot of those aren't the ones that, you have done in the doctor's office and they don't get sent away. So there's still a lot of flu, so. And she probably doesn't feel very good on steroids either, so
No, it's
how productive is she gonna be?
her heart rate's like 150
Yeah.
something, I hate that.
Hummingbird, yeah.
Okay, so there's a travel club trip this summer
Okay,
to go to Greece.
Okay.
For, I think it's 10 days,
mhm.
and it's the end of beginning of July. So is that Mrs. Williams and Mrs. McPherson said they're gonna meet with the superintendent to see if we can still go. But is that gonna take like
It could. I know some other groups, they, with universities, they're asking to suspend any overseas trips for, students, so, I think you kind of have to watch, and there's probably a date where they have to make a decision by. If that date is sooner rather than later, I would probably say it would, but if it's later, you can see what's happening. Hard to predict.
I think the biggest thing is gonna be like, when I look, okay, yeah, there's 1,000 confirmed cases in the United States. How many people live in the United States?
1,000.
Yeah.
Every 100.
So I mean,
And
you gotta
again,
keep it in perspective in
Yeah,
terms of
and I
the
think we
numbers.
have to brace ourselves that we just really started testing, in the United States too, so I think you're gonna see those numbers go up pretty quickly. Again, there's still lots and lots of people in the US.
Even China, I mean, they're,
And the other thing you gotta remember, a lot of the messaging is, if you have mild illness, just stay home. So some of those that may have it, that have mild illness,